my name is Rushien, and I'm going to be diagnosing you today. What's your name?
This is Dr. Mohammed speaking. This is your patient, Rushien, and she's happy to meet you. Her name is Habiba.
Habiba. It's very nice to
Yeah,
meet you, Habiba. And
ta
thank you.
ce tana gaishe ki. All right, that she's also very grateful.
Thank you.
Yeah.
Habiba, can you please tell me a little bit about yourself? Like how old you are, where do you work, where do you live?
All right. Kawai tana so ki dan mata bayani ne akan ki ko irin aikin da kike yi ko kuma uh, da sauransu dai kawai dan abu kaɗan dai akan ki haka. Ko yaran ki nawa, shekaran ki nawa. Okay. Sai me kuma? Za ki iya faɗa mata ko yaran ki nawa? Ai suna ganin ki a bidiyo din ne. A'a kawai ki faɗa yaran ki kaza, shekaran ki kaza, ga aikin da kike yi da sauransu. Okay. Mhm. Okay. Okay. So she said she's married and she is 55 years old. She has 7 children, and she is not gainfully employed. She's married to a retired civil servant.
Okay, that's nice. Thank you.
Yeah.
So tell me what brings you in today.
All right. Wai za ki iya faɗa mata me yasa kika zo asibiti yau? Me yake damun ki? Okay. Okay. All right. So she said she's having fever, general body weakness, and headache.
Okay, I'm sorry you're feeling this way. So, your fever, can you kind of explain this fever? Do you feel like it's like on and off, or do you feel like it's the constant and like continuous all the same?
Okay. Zazzabin nan yana zuwa ya tafi ne ko kuma tun da ya zo kawai yana nan ne har yanzu? All right. She said the fever is on and off, and it's more in the morning
In the mornings?
and evening. Yeah.
So, do you have kind of any other symptoms, maybe loss of appetite, dizziness?
Okay. Kina jin kaman jiri ne ko kuma kina jin bakin ki ɗaci haka ba kya son cin abinci? All right. She said she has degree of loss of appetite, but she doesn't have dizziness.
No dizziness. Okay, that's good.
Yeah.
Do you have maybe like shortness of breath sometimes? Can't really catch.
Okay. Akwai matsalar numfashi ne? All right. All right. She says she doesn't have loss of breath, no respiratory symptoms.
Okay, that's so good.
Yeah.
Can you please ask her if she has any chest pains anytime, maybe a cough sometimes?
Okay. Kina jin ciwon ciki ne? Okay. She says she doesn't have pain anywhere, no chest pain, no cough.
She does have a cough?
No, no cough, no cough.
Okay, perfect.
Yeah.
That's good. Can I ask to examine her if she's okay with that?
All right. Go ahead, please.
Can you please check for any pale skin, maybe yellow eyes, or any leg swelling if that's apparent?
All right. She's not. You can see she's not that pale. No, she's not that pale. The palms are not pale as well.
Perfect. Perfect. That's
Yeah.
good. So can you please take her temperature?
All right. Yes, her temperature is 37.9 degrees Celsius.
Okay, so that is kind of a little fever you do have.
Yes. Yeah.
And so I'm suspecting malaria here, and from your other, since you don't have any other symptoms like a cough or anything like shortness of breath, that's really good. So I don't think you have ARIs or anemia. It's no apparent symptoms. You don't have that, so that's good. So for your malaria, I'm suspecting I would like to run a rapid diagnostic test, if that's okay, doctor.
Yes. The RDT for this patient revealed 2 pluses of malaria.
2 pluses of malaria. Okay, so
Yeah.
you are positive with malaria. but good news is that it is treatable and it is not a complicated case. And so for uncomplicated case, we usually treat malaria with ACT. It's an artesin-based cometone. And so that's how you would treat your malaria. And I'd like to talk to you about kind of prevention methods in the future, so you don't have to come back in with malaria and you can like stay safe. What I would recommend is, as we know, malaria is transmitted by mosquitoes. And so I would really recommend investing in mosquito nets, or when you're sleeping, maybe wear long sleeves and long pants is a really good idea. And always kind of put mosquito repellent on if that's available to you.
Yeah. Yeah, that's very good. Rushien, you've done well. This patient actually has malaria from the symptoms and the examinations also. You try to rule out anemia, which is very good, even though the patient is not having anemia. And you also suggested the correct diagnostic test for this patient, which is RDT, which shows confirms the patient has malaria. You also suggested the standard correct treatment for this patient, uncomplicated malaria oral ACT, which is very good. And the preventive method also, wearing of long sleeves, you said it correct. And mosquito treated net, sleeping under mosquito treated net, which is very correct also. So you have done well, Roshan. Congratulations.
Thank you so much.
Yeah, welcome.
Can you please tell Habib that I hope she gets well soon? And thank you, doctor, for doing this with us.
You're welcome. And ta ce wai tana miki godiya da kika amince a yi wannan program da ke. So she said she's also very grateful and for what we people have done to her. And you are welcome as well.
Thank you so much.
So congratulations.